CNA Exam Ready. Welcome to the quiz. Question 1. Proper catheter care techniques are essential for preventing healthcare-associated infections in patients with indwelling urinary catheters. As you prepare to provide routine catheter care for Mr. Wilson, who has had a Foley catheter for 3 days following prostate surgery, you gather your supplies. Which solution should typically be used for daily catheter care according to standard infection prevention protocols? Option A. Antibacterial soap mixed with warm water for gentle cleansing. Option B. Hydrogen peroxide solution for its bubbling antimicrobial action. Option C. Isopropyl alcohol for its rapid evaporation and disinfecting properties. Option D. Povidone iodine solution for broad-spectrum antimicrobial coverage. The answer is A. Mild soap and water is recommended for routine catheter care. Antibacterial soap with water effectively cleans without disrupting normal skin flora excessively. Harsh solutions like hydrogen peroxide. Question 2. Patients with documented dysphagia, difficulty swallowing, require special precautions during feeding to prevent serious complications. As you prepare to assist Mrs. Gomez, a stroke survivor with moderate dysphagia, with her pureed lunch, you recall the most significant complication associated with improper feeding techniques in this population. A patient with dysphagia who is fed improperly is at highest risk for developing which specific respiratory complication? Option A. Aspiration pneumonia resulting from food or liquid entering the airway. Option B. Urinary retention related to autonomic nervous system dysfunction. Option C. Pressure injuries from prolonged positioning during extended feeding times. Option D. Severe constipation due to inadequate fluid intake with thickened liquids. The answer is A. Aspiration pneumonia is the most serious complication of dysphagia. Question 3. Postmortem care requires specific techniques performed with dignity and respect for the deceased. Following the pronouncement of death for a long-term hospice patient, you prepare to provide postmortem care. Which action is included in standard postmortem care procedures performed by nursing assistants? Option A. Remove all medical tubes, lines, and catheters to prepare the body for viewing. Option B. Position the body in a prone position, face down, to prevent pooling of fluids. Option C. Gently close the eyelids if they remain open after death. Option D. Apply fresh makeup to restore a natural appearance for family viewing. The answer is C. Closing the eyes gently if they remain open is standard postmortem care. This provides a more peaceful appearance and respects cultural norms. Tubes and lines are typically left in place until specific instructions are given. Question 4. Maintaining professional boundaries while providing compassionate care requires appropriate responses to patient behaviors. While providing evening care to Mr. Thompson, a 68-year-old patient recovering from orthopedic surgery, he makes inappropriate sexual comments about your appearance and makes suggestive gestures. What represents the most professionally appropriate initial response to this situation? Option A. Laugh nervously to diffuse tension while quickly changing the subject. Option B. Firmly but calmly state that such comments are inappropriate and unprofessional. Option C. Ignore the comments completely and continue with care tasks without reaction. Option D. Immediately leave the room to report the incident to the charge nurse. The answer is B. Setting clear. Question 5. Adapting care approaches for patients with sensory impairments enhances safety and communication. When preparing to enter the room of Mrs. Lewis, a 92-year-old resident with severe macular degeneration and significant visual impairment, which approach represents best practice for entering her room and initiating interaction? Option A. Knock once and immediately begin speaking to alert her to your presence. Option B. Enter as quietly as possible to avoid startling her with sudden noise. Option C. Announce yourself clearly, identify objects you're moving, and describe your actions. Option D. Turn on all available lights to maximize illumination before approaching her. The answer is C. With visually impaired patients. Question 6. Performing range of motion exercises correctly helps maintain joint mobility and prevent contractures in patients with limited movement. During a training session on proper ROM techniques, the physical therapist emphasizes important principles for effective exercises. Which statement accurately describes correct practice for performing range of motion exercises with patients? Option A. Perform exercises quickly and efficiently to minimize patient discomfort and save time. Option B. Complete a full set of exercises for each major joint at least 3 times daily. Option C. Continue each motion until the patient complains of pain, then proceed slightly further. Option D. Reserve all range of motion exercises for physical therapy staff with specialized training. The answer is B. ROM exercises should be performed at least 3 times daily to maintain joint mobility and prevent stiffness and contractures. Quick exercises risk injury and don't provide adequate stretching. Exercises should stop at the point of resistance or discomfort. Great job! Don't forget to subscribe. Bye!